let's go outside of the studio for our next segment. We're going to go west to where the sun is probably still up, and I'm sure the weather is perfect because we're headed to Los Angeles with Lisa Zamaski, consumer health columnist with the LA Times and also a health reform expert for WebMD. We were starting to inch outside of our borders here when we brought up Massachusetts, but first I'd just kind of like to ask you generally, how do you see this issue playing out across the country? Is this something other states, I presume, are dealing with as well?
In terms of a shortage of primary care?
Yes.
Yeah, absolutely. I mean, as your guests already cited, there's no question that there has been a shortage. It's a long time coming, and the expectation is, or the concern is, that a combination of factors. You mentioned the Affordable Care Act, which is obviously coming, and implementation will be complete in 2014. An aging population. You have a growing, complexity in terms of chronic care that primary care physicians need to deal with. And so it does vary by location. Some areas, the Northeast, the Mid-Atlantic, tend to have more primary care physicians than, say, in the South. But the other issues to access, I think, that came up that are important to mention do deal with the Affordable Care Act and the fact that there are a number of barriers, which, again, I think your guest alluded to, making it difficult for people to access primary care. Cost, for example, is a major one. And, the Affordable Care Act does potentially give access to primary care and to other medical services for people who've either not been able to get insurance or who've had difficulty affording insurance or going to primary care, getting preventative services.
So is this going to overwhelm the system even more if more people have access and we're not graduating enough doctors who want to be a primary care physician, for instance?
I think that it is absolutely one of the factors that does threaten to overwhelm our system, yes. And so we do have to start thinking about alternatives, as you've been talking about throughout the show. And the Affordable Care Act does, incidentally, support some of those things. Does encourage and start to shift the financial incentives as well for the medical system to try and be more focused on primary care and to pay primary care physicians as well for things that they're not currently compensated for, like care coordination and care management, which is so important.
Besides people who don't have access now, trying to get access, what about people who do have access? You hear some fears out there. Are they well-founded fears that as more people come in, I may lose access to my doctor, for instance?
Mm-hmm. I think that what we've seen, and I believe it's the case also in somebody referred to Massachusetts, the answer is it's possible, but I think that probably if you have an existing doctor, it's unlikely that you're going to be kicked off the panel. I think it probably will be more challenging for new patients coming into the system. There are situations, and we haven't seen all of the health plans obviously released in the new marketplaces yet, but there are incidences, for example, here in California, where some of the networks of providers are much more limited than perhaps some of the plans being sold today, and that can have an impact on your access to the doctors you want to see.
You mentioned Massachusetts. Can we look at Massachusetts where they have a very similar law and see how this is playing out as it pertains to primary care and kind of extrapolate to the rest of the country?
Well, I think that Massachusetts is unique in a number of ways. I mean, one thing for sure that makes it unique is I believe it has the highest number of primary care physicians per capita than any other state in the country. But there is no question that, as one of your guests mentioned, that there have been some issues with access. Interestingly enough, the Massachusetts Medical Society recently released a survey. They've been tracking this since the law went into effect in 2007. And it looks like an internal medicine and family medicine that, the wait times, they take a look at wait times, and they've fluctuated quite a bit over the years in those two professions, but they've remained relatively static. But it's a long period of time, and it varies throughout the state, but it's about 52 days they report, about 50 days today, compared to 52 in 2007, and about 39 days today to get in to see a family practitioner. But fewer of them are accepting new patients, and so that is a concern.
Lisa Zamaski, thank you so much for your time coming to us from Los Angeles. We appreciate this, your perspective, and thanks for being on the show.
Thank you.